Welcome to Allina Health's Cancer Institute Pre-Treatment Education. Our objectives of this presentation is to provide you with what to expect before, during, and after treatment, what to do if you have questions, what support services are available, including patient assistant programs, how to care for yourself if you experience side effects, how to schedule, reschedule, and cancel appointments, and last but not least, when and how to seek help. We recommend that you follow along in the companion book throughout this presentation. You may pause the video as needed to further review the materials in the book. You may also revisit this video in the future as needed. Throughout the presentation, you will see this red symbol that indicates the page number in the Chemotherapy and You book where you can find more information. The information included in this pre-treatment education is a general overview that we provide to all of our cancer patients. Today, we will review who is on the oncology care team, provide an overview of different handouts and literature, discuss treatments used to fight cancer, and review common treatment-related side effects and recommendations for home management. Throughout the presentation, we encourage you to write down any questions or concerns that can be addressed in your next clinic appointment. At your next clinic appointment, you will receive specific information about your treatment plan from a member of your care team. You will also have a tour of the infusion center and have opportunities to ask any additional questions. Navigating the challenges of a cancer diagnosis can be filled with many emotions, including feeling frustrated, angry, afraid, anxious, helpless, depressed, lonely, and many others. Having practical tools and healthy coping strategies will support your well-being throughout your treatment and cancer journey. Some examples include finding quiet time, using relaxation resources, talking about your feelings with others, seeking professional support, exercising, or joining a support group. You can find more examples of healthy coping strategies on page 10 of Chemotherapy and You. When thinking about your care team, imagine you're at the center of a big circle and everyone in that circle is there to help and support you. Each person's care team may have different members on it and may include a medical oncologist, advanced practice providers, integrative medicine specialists, a radiation oncologist, an oncology pharmacist, an oncology dietitian, a financial navigator, an oncology social worker, oncology nurses, a genetic counselor, a surgical oncologist, cancer rehabilitation, and oncology nurse navigators. All of us here at the Allina Health Cancer Institute are committed to working together and with you to support your individual needs every step of the way. There are multiple ways to treat cancer, and patients can have a combination of treatment types, including chemotherapy, which is medicine given to destroy cancer cells throughout your whole body. Immunotherapy, which is a treatment that helps your immune system fight cancer. Targeted therapy are medicines designed to target specific features of cancer cells and stop them from growing and spreading. Hormonal therapy uses hormone suppression to starve cancer cells that rely on certain hormones to grow. Combination therapy uses a combination of chemotherapy and other cancer-destroying medications. Radiation therapy uses high-energy radiation, think X-rays, to shrink and destroy cancer cells. Surgery uses surgical tools to remove tissue and possibly nearby lymph nodes. And clinical trials are studies done to assess the safety and effectiveness of drugs or protocols. Cancer medications can be given in many different ways. 3 common ways that medications can be given include intravenous or IV, which means the medication goes directly into the vein, an injection, which is a shot under the skin in fat or muscle, and orally, which is taking pills by mouth. Please refer to page 3 in Chemotherapy and You to learn about additional methods of administering cancer medications. If your treatment includes an intravenous therapy, you will require some type of catheter or line for administering the medication into a vein. A peripheral IV is a short-term use catheter, which is typically inserted and removed in the same day. Some treatments can be delivered safely through a peripheral IV, while others may require a central line. If you have experienced difficulty with blood draws or IV access in the past, talk to your care team about other options. Your oncology providers can help you decide the best type of catheter option for you, which may change over time. Intermediate use catheters include peripherally inserted central catheters, or commonly called PICC lines. A PICC line is a catheter inserted into the arm that delivers medications into a larger vessel. Administering medications into a larger vessel is often required for chemotherapy. PICC lines are good for longer periods of use compared to peripheral IVs and require periodic flushing and dressing changes. PICC lines are considered generally safe but higher risk of infection, as with any device that remains in the body. Your oncology providers can help you decide if this is the best option for you. Long-term catheters include ports, or often called portacaths or metaports depending on the manufacturer, and are implanted under the skin. Ports allow medications to be delivered through a large vessel and can be used long-term to both draw blood and deliver treatment. Ports are commonly used to deliver chemotherapy. A port must be accessed and flushed using a sterile technique and done by a trained healthcare professional. Ports require routine maintenance when they are not regularly used, and similarly to PICC lines, ports are considered generally safe but higher risk of infection, as with any device that remains in the body. Your oncology providers can help determine if this is the best option for you. Another type of long-term catheter is called a tunneled catheter, sometimes known as a Hickman. A Hickman is used for specific treatments and is partially implanted under the skin. Like ports, Hickmans can be used long-term to both draw blood and deliver treatment. Hickmans allow more than one medication to be delivered at the same time through a large vessel. Hickmans require diligent teamwork to avoid infection. Your oncology providers can help determine if this is the best option for you. The next few slides, I will discuss oncology treatment plans as well as review two specific examples of what an oncology treatment plan may look like. An oncology plan is usually described in cycles. Three common terms used to describe oncology plans include a treatment cycle, which is a predetermined number of days in a cycle. For example, a 21-day treatment cycle. Treatment days are the day or days within a cycle that a patient receives treatment. For example, a patient may receive chemotherapy on days 1, 8, and 15 of a 21-day treatment cycle. The number of cycles is the number of times the cycle will be repeated. So a patient may receive 6 cycles of chemotherapy. It's important to remember that each oncology plan is different, and some plans are more complex and can include taking oral medications daily or within a cycle, along with other treatments such as chemotherapy, immunotherapy, and radiation. Your care team will review your individual plan and provide clarity at your next appointment. Let's complete our first example of an oncology treatment plan. In this example, the cycle is 21 days long, and the patient receives an IV infusion on days 1, 2, and 3. As indicated below in yellow, the treatment cycle is 21 days long, and this is the patient's first cycle indicated by cycle 1, day 1. The patient will receive an IV infusion on treatment days 1, 2, and 3. The next cycle will begin 21 days later, where the patient will return for cycle 2, day 1. The next example reflects a patient who is receiving combination therapy of both an IV infusion and taking an oral medication. In this example, the cycle is 28 days long, and the IV infusions are given on days 1, 8, and 15, and the oral medication is to be taken days 1 through 21. Cycle 1, day 1, begins on the first Friday. The yellow indicates a 28-day treatment cycle, and the treatment days are day 1, day 8, and day 15, or the first 3 Fridays of this month. The patient will take an oral medication days 1 through 21 and have off from both the IV medication and the oral medication days 22 through 28. After day 28, the patient will begin cycle 2, day 1. If your oncology treatment plan requires a medication to be given in the infusion center, a typical day 1 of every treatment cycle will include a lab visit where you will have your blood work drawn, a clinic visit with a provider who will evaluate you for treatment and address any questions or concerns you may have, followed by an infusion center appointment to receive treatment. If your plan includes additional treatment days within that same cycle, you will likely have a lab visit prior to your treatment, but will not need to see a provider in the clinic. All of our infusion centers have additional supportive measures to make you as comfortable as possible during your visit. Please ask about our comfort menu. Additionally, please note that most treatment medications cannot be prepared until the patient is cleared for treatment on each treatment day. This may mean that you have a waiting period while your blood work is processed, your care team evaluates you for treatment, and the oncology pharmacists prepare your drug. Many patients are prescribed supportive medications to be used before and/or after treatment to manage side effects or boost treatment effects. Based on your treatment plan, you may receive prescriptions to begin taking before your treatment day, known as Day 0 medications. Your care team will review individualized plans at your next in-person visit and provide specific instructions. Please confirm your pharmacy of choice. 3 common supportive medications include steroids, which boost the effects of some treatments and decrease side effects of other treatments. A common steroid used is called dexamethasone or Decadron. Steroids can cause difficulty sleeping and increase blood sugar levels. We recommend you take this medication early in the morning to prevent difficulty sleeping, and if you have diabetes, to check your blood sugars regularly. Anti-nausea medications are another form of supportive medications and may be given as an IV infusion or taken as a pill. Anti-nausea medications are often given prior to IV infusions. Common medications include ondansetron or Zofran, prochlorperazine or Compazine, metoclopramide or Reglan, and olanzapine or Zyprexa. This type of medication can cause constipation, so we recommend having an over-the-counter stool softener or Miralax on hand. Another form of supportive medication is for your immune support. This type of medication is given as an injection, and it's given after treatments that are known to cause bone marrow suppression or low white blood counts. A common immune support medication given is called pegfilgrastim or Neulasta. This medication can cause achiness and bone pains, and we recommend taking Tylenol and Claritin if you experience this. If you are prescribed an oral medication to treat your cancer, it is important to always follow the safety precautions, including store medications in a secure location away from children and pets, do not skip doses, and if you are unable to take a dose, contact your care team. Take the medications as prescribed and in its original form. Do not cut, crush, or open capsules. Caregivers assisting with the administration of the medication should wear gloves when both handling medications or packaging and wash hands afterwards. Our specialty pharmacy team will reach out to go over the details of your medication, review the delivery plan, and help answer any additional questions. Please be sure to answer their calls, as they will not be able to refill your medication without speaking with you and verifying delivery information. There are many different types of specialty oral oncology medications, including hormonal therapies. Hormonal therapies may cause flushing or hot flashes and may cause changes in bone density over time. Your oncology providers will determine if bone strengthening medications are needed. Like other oncology medications, it is important to let your care team know if you miss doses for any reason, especially if it's due to side effects or new symptoms. If you are prescribed an oral oncology medication, you will receive it from a specialty pharmacy. An oncology pharmacist will be in contact with you to provide additional education about the medication, as well as discuss the delivery planning and confirmation that you have received the medication. The pharmacist will also review ongoing monitoring while on the drug, as well as the cost of the medication. It's important to know that many drug manufacturers offer patient assistance programs to help cover cost of copays. Ask to speak with a financial navigator if cost is a concern. If you are on an oral oncology medication for a blood cancer, you may be enrolled in the REMS program. REMS stands for Risk Evaluation and Management Strategies. This is a program that is a safety strategy to manage known or potential serious risks associated with certain medications. This program enables patients to have access to such medicines by managing their safe use. Patients must complete surveys upon enrollment and periodically to receive the medication and refills. Many patients ask, is it okay to reschedule an infusion or skip a dose? While we recognize that things happen in life, it is important to maintain your schedule of treatment and avoid missing doses whenever possible. If you need to change or cancel an appointment, please provide at least a 24-hour notice to your care team. Our schedulers will work closely with your oncology team to determine the best plan for rescheduling. Additionally, there may be times that your treatment will be postponed due to side effects you are experiencing. If your treatment schedule needs to change, your care team will explain what to do and review your new plan. Partnering with your care team during your cancer journey is essential. Remember, communication is key. It is important to report side effects and/or new symptoms to your care team. To help track changes that may result in modifications to your plan, you will be asked to periodically complete oncology screenings. Oncology screenings help us identify when you may need additional assistance in areas including symptom management, nutritional support, mobility and activities of daily living, emotional well-being, and financial support. Studies show that patients who use surveys to report how they are doing can have better treatment outcomes. How will treatment make you feel? There are many factors in how treatment may make you feel, and each patient responds differently. Additionally, there have been many advances made in managing side effects from treatment. Next, we will review steps you can take to help prepare and manage possible side effects. Side effects are problems caused by cancer treatment. You may have a lot of side effects, some, or none at all. Side effects depend on the type and amount of treatment you get and how your body reacts. Your care team has many ways to prevent and manage treatment-related side effects. Make sure to let your care team know about any changes you notice, as they may be signs of a side effect. The following are common treatment-related side effects that we will be reviewing. You can find more information in the Chemotherapy and You book on page 12. Fatigue is the most reported side effect of patients undergoing cancer treatment. Management strategies include take time to rest when needed, Save your energy for activities that are most important to you. Eat a balanced diet with adequate protein intake. Drink plenty of fluids and avoid caffeine and alcohol. Take short walks or do light exercise once a day if able. Ask friends and family for help. Reassess your work schedule if needed. And ask your provider about a referral to our cancer rehab specialists. More information can be found on page 23 of Chemotherapy and You. Pain and changes in sensations and sensitivities can be a treatment-related side effect. Pain can also be caused by the disease or the treatment. The type of pain depends on the affected body parts, the type of treatment you are receiving, and other existing factors. It is important to keep your care team informed about your pain and be specific about the following: what the pain feels like, when it starts, how long it lasts, and what makes it feel better or worse. Change in sensations and sensitivities can also be common. Cold sensitivity is a common side effect in some chemotherapies. Tingling, burning, weakness, or numbness in your hands and feet may also be caused by certain treatments and should be reported to your oncology team. Some pain and sensitivities can change over time and require modifications to your dose or treatment plan. You may be referred to our palliative care team for additional symptom support. More information can be found on page 39 of Chemotherapy and You. Appetite, preferences, and taste can change over time during treatment. It's important to remember to stay hydrated and eat throughout the day even when you don't have an appetite. Try including foods and supplements that are high in protein as well. If you do experience a change in appetite or taste, we recommend the following. Try eating small, frequent meals each day instead of 3 big meals. Set a daily schedule for eating meals and snacks, as you may not feel hungry and have the cue to eat. Try drinking milkshakes, smoothies, juice, or soup if you don't feel like eating solid foods. Remember, all calories are good calories when your appetite is low. A resource that many patients find helpful is Eating Hints Before, During, and After Cancer Treatment, created by the National Cancer Institute. Please pause the video and scan the code with your phone camera to receive a free digital copy. Many oncology medications are dosed based on your current height and weight measurement. You can expect to be weighed at each visit you see your provider. Your height may also be measured regularly, as some treatments can affect bone density or cause bone loss. Oncology treatments can cause both weight loss and weight gain. Patients identified at risk for weight loss or other nutrition concerns will be referred to an oncology dietitian. Each oncology treatment is evaluated for potential to cause nausea and vomiting. Some treatment regimens cause more nausea than others. If your treatment has the potential to cause nausea, you will receive anti-nausea medications. This medication may be given prior to your IV infusion, and you may receive pills to take before and/or after treatment at home. If you receive IV forms of anti-nausea medications, your infusion nurse will let you know when it's safe for you to take your at-home anti-nausea medications. Many patients will receive more than one at-home anti-nausea medication prescription. Some patients find that one type of medication is more effective than another. Some find it's helpful to alternate taking these medications. Follow the instructions on your prescriptions and do not take more than prescribed. If you are experiencing nausea or vomiting despite maximum use of your at-home anti-nausea medications, please contact your oncology care team for further evaluation and management. Additionally, some patients find complementary care to be useful, including aromatherapy and acupressure bands. please ask to see our comfort menu in the infusion center. Additional information can be found on page 35 of Chemotherapy NU. Many oncology treatments can cause diarrhea and/or constipation. If you experience diarrhea, remember to stay hydrated. Aim to drink 8 to 12 cups of clear liquids each day. Eat small, frequent meals and snacks, and avoid 3 large meals. Eat a low-fiber diet, including foods like rice, toast, yogurt, and bananas, and avoid spicy and high-fat foods. Be gentle when wiping your skin. Contact your care team if you have any of the following: 4 or more loose or watery stools in one day, if the diarrhea lasts more than 24 hours, if you have pain, cramping, or blood with diarrhea. If you experience constipation, stay hydrated. Aim to drink 8 to 12 cups of clear liquids each day. Stay active. Even short walks can help get your bowels moving. Check with your care team before using fiber supplements, laxatives, or enemas. Let your care team know if you are unable to have a bowel movement for more than 2 days past your normal schedule. More information can be found on page 20 and 21 of Chemotherapy NU. Managing dry mouth and mouth sores. Strategies for dry mouth related to treatment include staying hydrated. Frequent sips of water and non-caffeinated drinks can be helpful, as well as chewing gum or sucking on hard candies. Perform frequent gentle mouth care and use mouth moisturizers such as biotin or Act Dry Mouth. If you experience mouth sores from your treatment, we recommend the following management strategies. Use a salt and soda rinse 3 to 4 times a day. You can make a batch of this rinse with 1/4 teaspoon baking soda, 1/4 teaspoon salt dissolved in a warm cup of water. Make sure to make a new batch daily. Swish this mixture for 30 seconds to 1 minute before spitting out. Other strategies include chew soft foods that are easy to chew, cut food into small pieces, suck on ice chips, and avoid hot, salty, or overly seasoned foods. Avoid citrus and acidic foods and drinks as well. Please note that you should contact your care team if dry mouth or mouth sores are impacting your ability to eat or drink fluids. More information can be found on pages 32 to 34 in Chemotherapy NU. Changes to skin, hair, and nails are common treatment-related side effects. Skin. Throughout treatment, keep your skin clean and moisturized, and report any new rashes, non-healing wounds, or skin concerns to your care team. Hair. Although many treatments do cause hair loss, not all treatments cause hair loss. Review your medication side effects to see if hair loss is expected with your regimen. If hair loss is expected, other resources are available, including cold capping and wig resources. Nails. Nail care is also important during treatment. Keep nails trimmed, wash your hands frequently, and apply lotion to hands to avoid cracking and bleeding. More information can be found on pages 25 and 44 of Chemotherapy NU. Blood and immune system changes. Some treatments will deplete the body's blood cells, which are produced in the bone marrow. This can cause a drop in white blood cells and neutrophils, cells that fight infection, hemoglobin, red blood cells that carry oxygen, and platelets, cells that help the blood clot. When these blood cells are low, a person is at a higher risk for infections, anemia, and bleeding. Management strategies include staying away from people who are sick. This includes people with colds, flu, measles, or chickenpox, and you may need to stay away from children who just had a live virus vaccine for chickenpox, MMR, or rotavirus. If you have questions, please contact your care team or local health department. It's also important to report any signs or symptoms of infection, including a temperature equal to or greater than 100.4, and to report any abnormal bleeding, including bleeding when brushing your teeth. Your treatment plan may include a bone marrow stimulant to help your body produce blood cells. A common medication given is called pegfilgrastim or Neulasta. Finally, please use personal protective equipment in public, such as wearing a mask, to protect yourself as needed. More information can be found on page 27 of Chemotherapy and You. Strategies to stay healthy at home include frequent hand washing with either soap and water or hand sanitizer, and stay away from people who are sick to reduce your risk for infection. Have adequate food and fluid intake. Aim to have high protein and high calorie foods and fluids. Stay hydrated and avoid caffeine and alcohol. Staying active is also a great strategy. Try to maintain your current activity level. This can be done by taking short walks or light exercise each day if able. Do activities that you enjoy or make you feel good. Many patients find it helpful to keep a daily journal of how they're feeling. When and how to seek additional help. Call your Allina Health Cancer Institute if you experience any of the following: a temperature equal to or greater than 100.4 degrees Fahrenheit, if you experience shaking and chills, if you have nausea or vomiting with weakness or dizziness, if you have new bleeding, if you have new or worsening shortness of breath that does not improve with rest or is accompanied by painful breaths, if you have new or worsening pain that is not resolved with your pain management plan, if you are unable to eat or drink for more than 12 hours despite medication use, if you have excessive diarrhea not responding to medications, if you have constipation with pain that is unresolved with medications or constipation with vomiting. Based on your clinical situation, you will be given instructions such as how to manage your symptoms at home. You may be asked to come to the clinic for further evaluation, or you may be instructed to report to the nearest emergency department. Safety at home after chemotherapy treatment. Chemotherapy is considered a toxic substance and may remain present in your body waste for a minimum of 48 hours or on average 2 days after treatment. This includes blood, urine and stool, vomit, semen, and vaginal discharge. Because of this, chemo precautions at home are needed. For a minimum of 48 hours after chemotherapy, if you use products for incontinence, not being able to control your bladder or bowel, wear disposable gloves when handling used products. Seal the gloves and the used products in 2 plastic bags. Dispose of the bag in your regular trash. Wash your skin if any urine or stool gets on it. Wash your hands with soap and water. Sit on the toilet to urinate regardless of gender. Close the lid and flush twice each time you use the toilet. Clean up any splashes on or around the toilet, and wash your hands well with soap and water each time after using the toilet. Wash clothing and or linens soiled by body waste separately and in hot water. Use condoms or barrier protection during sexual intercourse to prevent exposure to your partner. Frequently asked questions. Can I continue to work and do activities such as exercise? You should be able to continue to perform all activities you enjoy unless your care team has advised you not to. This includes work and exercise. Can I take over-the-counter medications? Talk to your care team before taking any new over-the-counter or prescription medications, vitamins, minerals, dietary, or herbal supplements. What can I do to make it easier to have my port accessed? Some patients find it helpful to apply a thick layer of aspartame, lidocaine, or emla cream over the port site and then cover it with a piece of plastic for 30 to 60 minutes before the port is accessed. What can or should I plan to bring to my infusion visits? Many patients find it comforting to bring items from home that help them relax. A favorite blanket, non-slip shoes or slippers, craft or activities to stay busy can be helpful. Please ask the infusion nursing team about our comfort menu, including enhanced nutrition offerings. The Cancer Institute has additional resources, including booklets and handouts on eating hints, foods that have protein, how to deal with fatigue, how to manage diarrhea and/or constipation, tips for managing your thinking changes from cancer treatments, medication sheets, and additional resources are available upon request. You can also visit the following websites to learn more about your diagnosis, treatment, side effects, and management strategies. What to do if you have questions or need help during or after hours. Contact your Allina Health Cancer Institute clinic. If it's during business hours, you may contact the clinic triage nurse or call the clinic number and follow the phone prompts to reach the desired specialty department. If after hours, call the clinic number and follow prompts for the on-call provider. Please do not leave a message if you need help or have questions that must be answered before the next business day. To ensure you can contact the clinic, we recommend you save the clinic number in your cell phone. We also recommend storing the number in an easy-to-find location, such as on the refrigerator. Additionally, the clinic contact number can also be found in your after-visit summary from every clinic visit on MyChart. If you haven't already done so, we recommend you register for an Allina Health MyChart account. This account gives you access to your medical records, as well as provides an easy way to communicate with your Allina Health care team. Ask a member of our team if you need any assistance registering for an account. This concludes our pre-treatment education. Thank you for watching. Please feel free to watch this video as needed and ask any questions at your next appointment.